Hi everyone, Dr. Bernard, the President and Clinical Director at Be Transformed Mind Body Wellness Center, and with me is Tim Marsh, Director of Massage Therapy, Rehab, and Personal Training. Today we're going to speak to you about thoracic spine, biomechanics, and connective tissue disorders. Tim.
Number one, everybody has a foam roller, and notice how this foam roller is flat. Is their spine flat? So what I started to look at, because I deal with clients who have fibromyalgia, autoimmune disorders, I specialize in PTSD and emotional trauma release. So I started to think if this flat roller could be causing some of the problems. Then I came here and Dr. Bernard introduced me to what's called the proper foam roller. Now, what I love about this foam roller is it has a channel, and the channel is a lot different than the flatness. So speaking for myself, I used to suffer from allergies, and now it's July and I can breathe easy. I believe one of the reasons I can breathe easy is because I was introduced to this foam roller, and instead of jamming my spine up inside itself, this channel keeps it safe. So then what I started to do with my clients who have all these types of things, I started to have them use this, and I started to notice a difference with myself and my clients. So what I wanted to do is I wanted to just put in the myofascial part, is that if we're trying to dig out the spine and we use this on a daily basis, the spine is going to sit perfectly in here, and these little knobbies are going to be able to get in there and start to get that soft connective tissue, have more blood flow, more range of motion, proper progression from sports to rehabilitation. So with that in mind, I'm going to kick it back over to Dr. Bernard, and he's going to talk about the specifics.
So when we look at the human spine, so we can see here in the thoracic region, what we should see is a normal kyphosis. And part of the problem in chiropractic is restoring motion to each of these motor units. When we're trying to do that on a spine that may have a reduced kyphosis, on first a flat roller, what we find is we're actually pushing into an area that's already restricted in motion with bad spinal kinesiopathology. When we find a better product which is designed more for the spine and ergonomics, now we find the spine moves easily, and it's restoring motion into each of those motor units as we're working through the thoracic spine. We also see not only range of motion improving, but pain decreasing throughout the spine. Tim?
And just to pick up on that, thoracic 8 and 9 vertebrae are linked to spinal nerves that have to deal with hives, allergies, also the nervous system, but also more important, the adrenaline system. So if we are dealing with clients, or you're dealing with issues from fibromyalgia, autoimmune, you've got anxiety, it could be the missing piece could be getting away from a flat traditional roller and getting into more of one that is designed to do its job. In my professional opinion, this is antiquated. We need to stop thinking about using these because, just like Dr. B said, we're causing, in my opinion, in our opinion, you're causing too much trauma in this region. And to talk more about subluxation and the spinal nerves, Dr. B.
All right, so chiropractors, anybody working with spinal kinetics, we need to be moving and working on movement and functional movement. That's where we're going in the 21st century. So old theories, old ideas, like these old foam rollers just don't work. We need to move up and restore things back to proper. The chart we're alluding to here behind us is the Merck chart, which shows all the spinal nerves and where they go. So as we're improving the mechanics throughout the thoracic spine, we're reducing subluxations, we're improving and restoring all the proper mechanics as we should be. So if you're looking for one of these amazing proper rollers, you won't find it on Amazon.
Nope.
So you can give us a call. We have them in the office, and even better is come on in and give us a call and get a consult about things that we might be able to help you with for thoracic spine, connective tissue disorders, and also spinal pathology. Thank you very much for listening.